Hello, welcome, welcome. Thank you for being here. I'm Bridget Factor, a certified nutritional therapy practitioner, and I'm here to answer your questions today. So, quick disclaimer, the information presented in this video is for educational purposes only, and if you are dealing with a medical issue, you need to seek the advice of a licensed medical provider. Okay, so we got that out of the way. Again, thank you for being here. So, today we're going to talk a little bit about depression. Now, last week we talked about anxiety, and I touched on that a bit. Today I want to go a little deeper and talk about depression. And the question I would like to address is, can depression be caused by inflammation? There's a lot of new research out pointing to this issue. So historically, we've been told depression is a serotonin imbalance, and you have to take medication to address the issue. But what we know now is that is not entirely the case. It may be the case for some people, it may not be the case for some people. So the research is pointing to the idea that inflammation inside the body can actually cause depression-like symptoms. And so I wanted to talk about that today. There can be situational depression where you have a tragic event in your life or something happened that puts you in a depressed mood or a down mood, or you're sad, and that's normal. Those things can happen. I also believe there can be spiritual depression. So some people can be spiritually attacked and it can affect their health and their life. So, but what I want to convey to everybody today is that there can be different reasons we feel depressed or we're classified as being depressed, and it's not all in your head. It's not, that there's something wrong with you, or you just need to snap out of it. That's not the case. There could be something physiological going on inside your body that could be contributing to this. So I want to teach you a new word today. I love this. So let's get our geek on. Psychoneuroimmunology. It's a new concept, and it is the science of studying how our psychology affects our neurology, which can affect our immunity. So psychoneuroimmunology. So how the thoughts in our head can affect our brain chemicals, which can in turn affect our immune system. So there is evidence that the way we think can, the negative thinking cycles that we can get into can actually alter our brain chemistry, which then can activate our immune system, causing inflammation. There's also evidence that this goes the other way around, that if you have something going on inside your body that's activating the immune system, causing inflammation that's circulating through your body, that this can then affect what's your brain. It can cross the blood-brain barrier and go and activate your brain's immune system, releasing more inflammation, which then in turn will affect how you view and how you think and your overall emotions or emotional balance. And so what I'm trying to say is that it can go both ways. So there is a mind-body connection. We know this, and it is a two-way street. So the thoughts we think, what we are exposed to, can affect our biology, and our biology can affect how we view the world or how we think. So I wanted to point that out. So some of the sources of physiological inflammation that can lead to depression-like symptoms are processed foods that cause inflammation in the body. So eating an anti-inflammatory diet that's low in refined sugars, low in refined carbohydrates, full of good healthy fats can help. Gut dysfunction. So the imbalance of gut bacteria, if we have, infections or bacterial overgrowth or not enough bacteria, if we take too many antibiotics. Also, if we have leaky gut, which is called intestinal permeability, that can actually send signals to the brain and cause inflammation. So that is another issue that can be addressed. Sedentary lifestyle, so not getting enough exercise. Exercise is actually more powerful than any antidepressant out there. So that can be a big piece. And chronic stress. So, being in a chronically stressed state, whether it's emotional stress or whether it's something going on inside your body, creating stress. Your body reacts all the same way to all stress. So those are some issues that I wanted to present to you that you can actually use to kind of help you, or if you know somebody dealing with this, to understand that there can be multiple things going on and that we want to look at this from all directions. So taking a holistic approach, one, making sure we have a good foundation of nutrition and diet and exercise and sleep and all that stuff. And the other one, making sure that we are feeding our mind with positive thoughts, that proper thinking, telling ourselves the truth. And so sometimes that may involve seeking therapy to help us work through those issues. Sometimes that means you need to get plugged in to a good spiritual community where you can start to learn the truth about who you are and why you're here. Those are all ways that we can address this issue. So I know this is a deep topic for people. So if you have a question, please post it, and let's carry on this conversation in our Facebook group, the Restorative Wellness Community. And I look forward to interacting with you there. So thank you for watching, and until next time, grace and peace to you.